The CDC's new guidelines say if you want to get a COVID vaccine, you should talk to a health care provider first.
As Tan Trung reports, the CDC issued those guidelines at a time when there's a lot of debate and confusion surrounding the vaccine.
In a major reversal, the CDC got rid of its universal recommendation for the COVID vaccine. If anyone wants the shot, it urges patients to talk with their doctor first. The CDC's acting director recently issued this statement: "Informed consent is back." CDC's 2022 blanket recommendation for perpetual COVID-19 boosters deterred healthcare providers from talking about the risks and benefits of vaccination for the individual patient or parent. That changes today. The new CDC guideline reflects the Trump administration's skepticism of certain vaccines, including for COVID.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
Last month, during a heated hearing with U.S. senators, Health and Human Services Secretary Robert F. Kennedy Jr. said the COVID vaccine was a miracle that allowed the U.S. to get back up and running from the pandemic. But it's no longer needed.
Right now, we're dealing with completely different circumstances, where the virus has mutated, where it's much less dangerous, where there's a lot of natural immunity and herd immunity. And so the calculus is different.
Senator Bill Cassidy, a doctor and Republican from Louisiana, is a supporter of vaccines and says the updated CDC guidelines are attempting to put hurdles to access.
This takes power away from the patient, and it gives it to people who are prejudiced against immunizations in general. And by the way, I would say prejudiced against President Trump's crowning achievement, which is Operation Warp Speed, which helped develop these vaccines. I'm totally against it. I'm about expanding access, not cutting it off.
The CDC is adjusting its recommendation for the COVID vaccine. As a doctor, where do you stand on it? Would you recommend the COVID vaccine for people who are eligible for it?
I would, and I do.
Dr. Jennifer Avegno is director of the New Orleans Health Department. She says the politics surrounding vaccines have made it confusing for patients. For a time, Louisiana and other states required a prescription for a COVID vaccine, causing major pharmacy chains to stop offering it. But under the new CDC guidelines, patients don't need a prescription, just consultation with the healthcare provider or pharmacist, something Dr. Avegno says has always taken place.
The recommendations encourage patients to participate in what's called shared decision making. And really, that's something that we as doctors and pharmacists do all day long, which is just have a conversation with the patient when you're about to give them the vaccine or when they're asking you a question.
Avegno says there's plenty of debate and discussion about vaccines, but the most important is the one you have with your doctor. In New Orleans, Tan Trung, Fox 8 Local First.